Dear colleagues, this is Desiree Wussler from Department of Cardiology and Cardiovascular Research Institute in Basel, and I welcome you to my presentation about the effect of comprehensive vasodilation versus usual care on mortality and heart failure rehospitalization in women with acute heart failure. As the pathophysiology and the response to treatment may differ between women and men, guidelines recommend evaluating the risk-benefit ratio of novel therapies individually in women and men. Among patients with acute heart failure, a strategy of intensive vasodilation compared with usual care overall did provide comparable outcomes. Therefore, the purpose of this study was to evaluate the effect of a strategy that emphasized early, intensive and sustained vasodilation in women with acute heart failure. In a randomized, open-label, blinded endpoint trial, patients hospitalized for acute heart failure were enrolled in 10 hospitals in Switzerland, Bulgaria, Germany, Brazil and Spain. Patients were randomized 1-to-1 to a strategy of early, intensive and sustained vasodilation or usual care throughout the hospitalization. The primary endpoint was a composite of all-cause mortality or AHF rehospitalization at 180 days. 781 patients completed the trial and were eligible for the primary endpoint analysis. Of these, 37% were women. The primary endpoint, a composite of all-cause mortality or rehospitalization for AHF at 180 days, occurred in 53 female patients in the intervention group compared to 34 female patients in the usual care group. As you can see in the displayed Kaplan-Meier curve, this resulted in a steep gradient in the proportion of patients with an event in the intervention group compared to the usual care group. To conclude, among women with acute heart failure, a strategy of early, intensive and sustained vasodilation compared to usual care had a detrimental effect on a composite outcome of all-cause mortality and acute heart failure rehospitalization at 180 days. I thank you for your attention and I'm open for your questions.